Bonjour and bienvenue. Good afternoon and very warm welcome to all of you and our special guests, Your Excellencies, President and First Lady, and the Honorable Carolyn Bennett, Planet Youth, distinguished panelists, youth delegates. I'm Dr. Teresa Tam, Canada's Chief Public Health Officer, and my personal pronouns are she, her, and elle. I would like to start by acknowledging that Canada is the homeland of First Nations, Inuit, and Métis peoples, and that this meeting is hosted in Ottawa on the unceded traditional territory of the Algonquin and Anishinaabe people. Je tiens d'abord à reconnaître que le Canada est la patrie des Premières Nations, des Inuits et des Métis, et que la présente réunion a lieu à Ottawa sur le territoire traditionnel non cédé du peuple Algonquin and Anishinaabe. The Algonquin and Anishinaabe people are the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory. I'm honored here today to facilitate a discussion about youth well-being and prevention of substance use and what we can learn from one another. In 2018, my annual Chief Public Health Officer report focused on preventing substance use in youth, in recognition of the importance of reducing known risk factors and strengthening a broad range of parental, family, school, and community, what we call upstream protective factors for the overall mental and physical health of children and youth. The Icelandic Prevention Model was provided as a key example or case study in my report. So this is why I'm personally really looking forward to today's event. Thank you to the Embassy of Iceland for hosting today's event. To start things off, I would like to give a warm welcome and invite to President Johannesson to come up and say a few words. And he'll be followed by Heather Jeffrey, President of the Public Health Agency of Canada. Welcome, President Johansson.
Your Excellence, dear distinguished guests, it's a pleasure and honor for me to be here with you on my state visit to Canada. It's a tremendous honor to be president of your country. Can you imagine? It's an honor every day. Tremendous honor. And each day is different. No day is the same. Always something new. I wish I could say always something fun. Today is fun. Today is exciting. And today is full of purpose as well. One of my favorite days, though, is not this day, this business of state visits. They're fun, they're important. Prevention Day in early October is one of my favorite days in the calendar. Then I have the opportunity to go to schools, colleges, talk to kids. And I was in academia. I was a lecturer, full-time professor, and I think I learned then that lecturing doesn't get you anywhere unless you try to engage. It's not about giving a lecture. It's not about or giving orders. It's about engagement. So I try to talk to these kids. I try to say, what do you want to do when you grow older? What do you want to do with your life? And isn't it smarter that the more you control your destiny yourself, the more likely you are to achieve your dreams? I'm not saying it's going to be perfect. I'm not saying there's going to be no challenges. But if you yourself say to yourself, I'm going to be in charge, then you're way more likely to be able to say afterwards, yes, I did it. There's a saying in Icelandic, hver sinnar gæfu smiður, and I'm sure you agree. Basically, it translates like one is in control of one's destiny. But the almost funny thing is that you can add a question mark to it. Who is in control of his or her destiny? We want to be in charge, but we know that things can happen. We will face challenges through no fault of our own. And then I add, when I give these talks to the kids, we're there to help you. We want to help you. If you need assistance, come talk to us. Tell us what's going on. Don't hide it. Don't just try to struggle with it on your own. So a combination of a feeling of self-worth and the realization that we're there to help, that will get you somewhere. So on Prevention Day, these are the things I try to emphasize. Back home, we have seen positive changes when it comes to teenage misuse of alcohol, tobacco, drugs. And it's not only because my generation has grown of age. It is because we saw and felt and realized that something had to be done. There were too many teenagers who were, through some gaps, through some emptiness in their lives, turning to alcohol and so on and so forth. We managed to reduce the percentage numbers from, I can't even remember, there are people here from Planet Youth who will correct me, but I think it was something like 44% of teenagers consuming too much alcohol every week, to about 2% today or something like that. And we're working on those 2%. Keys in this were trying to have more family time, encouraging parents and those with children to spend more time with them, to make sure that there were opportunities for children to take part in music, arts, sports, subsidies in this regard, and we've seen the results. So I do not want to preach to you, dear Canadians, but I still want to tell you, in all modesty, that there is something here you can possibly learn from us. And if you don't believe me, we have actual results here in Canada already. We just want to spread the word yet further. So I'm honored and pleased that we are here to discuss how we can make the lives of young Canadians, Icelanders, all others, that much better by just beginning by telling them, you should be in charge of your life. You should be the master, but challenges will be there, and then we're there to help you. So this is what I hope we will achieve on this visit and in this symposium here, that we will all agree on what can be more important than that. So thank you very much for attending this event. I look forward to watching and listening, and I am sure that we will all, at the end of the day, feel that it was a time well spent. Thank you very much. Takk fyrir.
Good afternoon, everyone. I'm Heather Jeffrey, the President of the Public Health Agency of Canada. It's my great privilege to be here with you all today to listen to these very important words. And I want to thank President Johannesson for his inspirational words, not only as someone who is trying to implement and champion the mandate of public health, but also as the mother of 3 teenagers who go through many of these struggles every day. L'Agence de la santé publique de Canada est fière d'être ici aujourd'hui pour parler de la santé et du bien-être des jeunes et de la prévention en amont. We know from the evidence that the President has just referred to that community-driven prevention programs designed for youth not only improve their overall health and well-being, but also reduce and in some cases delay harms among youth, including those from substances and adverse mental health, which have the benefit well into adulthood if they can be addressed early on. Prevention efforts have the potential to influence the whole range of trajectory of lives and work and many outcomes we never planned on. Nous savons que la prévention fonctionne et nous sommes ici cet après-midi pour entendre comment elle fonctionne dans les différents contextes canadiens et global. We're very eager to hear more about the Icelandic Prevention Model and how it's been used in other countries. The evidence that we've heard to date is very striking, and we see it not only in Iceland, but in many other countries where it's been implemented, including here at home. So we're very pleased to have a chance today to hear about all of this work firsthand from the community support and the Indigenous parallel of Planet Youth Calgary to the provincial role in establishing Planet Youth New Brunswick and their bilingual implementation of this program, and the grassroots work and youth engagement of Planet Youth Lanark County, which is just here close to Ottawa, close to home. So I'm very excited to listen to our panelists today and to prepare to build on this momentum as we in Canada prepare to launch our new program, Canada's community-based program to prevent substance use among young people. And especially fortunate to have Dr. Tam here today to moderate and lead us through this panel discussion as she's led us through so much during the COVID pandemic as well here at home. So thank you very much.
Thank you. And I'm going to invite the panelists to come on stage. And while they're doing that, I'm going to recognize 3 youth representatives in the audience today. Peyton Bell, grade 11 student from Carlton Place. Rayleigh Gagnon, grade 8 student from Carlton Place High School. And she wanted to say that Planet Youth is important because if we don't change now, we never will. We also have Rowan Tunks, grade 8 student from Carlton Place High School. And Rowan wanted to say that Planet Youth is important to me because I want to help my community make changes that will last generations. So if I could just get the panelists to go on stage. So as we've heard from our opening remarks, we are here to learn from all the people who are going to be on the stage today on their implementation of upstream prevention, more specifically on the Icelandic Prevention Model and how they're being implemented within the Canadian context as well. I will be inviting each of the panel members to introduce themselves and then briefly describe their background and program. And I'm going to start with Dr. Paul Rickerson, who is the Chief Executive Officer of Planet Youth Iceland, followed by Melanie Cormier, the Senior Program Advisor, Public Health New Brunswick, then Joanne Pinault, the Director of Acastimon, United Way, Calgary and area, and finally, David Sompi, Chair of the Planet Youth Lanark County Steering Committee. And we'll have, I hope, plenty of time to get some questions and answers from the audience.
All right. Everybody hear me? Your Excellencies, distinguished guests, my name is Paul Rickardson. It's Paul Rickardsson, but when I say that, people just say Gesundheit, so Paul is good, Paul is good. So I'm the Chief Executive Officer of Planet Youth, and we are an organization that has developed a methodology to adapt and implement the Icelandic Prevention Model in different contexts and cultures. And as you've heard, the Icelandic Prevention Model is a data-driven upstream primary prevention approach. And what we have been doing is to generate this methodology to implement in other countries as well, because what works in Iceland doesn't necessarily work in Canada or Mexico or Australia or the other countries that we are in. We are a relatively recent phenomenon. We have a history of about five years, but the history of the Icelandic Prevention Model is obviously longer. But we are now present in 16 different countries, working with 27 different implementation partners, reaching, I think at latest count, 560 different communities, which are all different. We're on the 5 continents, and it's been quite a ride for the past years, because this idea of preventing problems, this idea of working with upstream initiatives and actions to prevent problems from arising has resonated with decision makers around the world. And it's critical for me also to mention that, like I said, we're not exporting what was done in Iceland. We're exporting a process by which the things that we are doing are made possible in other cultures and contexts. We're also data-driven, like the guidance program and what is done in the partner communities is data-driven. It's not based on feelings or this work because I'm a parent or this work when I was a kid. It's based on data. It's the voice of the kids that we are consulting and using that data to make decisions about the initiatives and actions and interventions that are to be implemented. And these are partner-defined. We at Planet Youth don't tell the Mexican partners or the Australians or the Belgians or the Irish partners or the Canadian partners what to do. We provide the process and the knowledge and the support, but then it's the partner that defines and designs the intervention that work in the cultural and political context that the partner has. And this is what generates the results. Using data, using the partner knowledge of what to do, and thinking upstream, changing the mental model from treatment. Obviously, we need treatment, but changing the mental model from treatment to upstream prevention. So I'm really happy to be in this panel. I'm quite looking forward to the discussion and questions, so thank you very much.
So maybe, I'll just have a supplementary question. So there's a lot of jargon, so I'm not sure if people all got what data-driven primary upstream prevention approach means, but you explained some of that, and there is a pamphlet at the front desk for people who haven't picked it up, and so you can get a bit more information on that. But I'm really happy that you talked about a data-driven approach. And so can you tell us a little bit more about how that data is generally being utilized, particularly maybe in the Iceland context? But anything additional that you want to add about your overall experience around the world? I think when we were preparing for this session, I asked you, what was your most frequently asked question that goes to you? So could you maybe reflect on some of that?
Yeah, so I think the absolutely most frequently asked question is mainly, so Iceland, you're a small dysfunctional family close to the North Pole. How hard can it be? It's 360,000 people. Why should things that work there work in other contexts? And the answer is that the things that work in Iceland don't necessarily work in other contexts. But the process by which these actions are taken and decided on, that works in all contexts. And I think maybe the natural force that we are tapping into, and I see this, I travel a lot. I was in 10 countries last year. I've been to 7 countries this year. I was in South Africa in February, going through the unofficial settlements, looking at parents with very little means. And I think the force that we are tapping into is that it doesn't really matter where you are in the world. Parents just want the best for their kids. Parents just want to make life better for their kids. So I think Planet Youth is about love, basically, the love of parents for their kids. And that's the force we're tapping into, and that's the process by which we are implementing that expression. I'm really poetic here, but I think that's what we do.
Great. And in the material that you can find in this pamphlet, I think there's some really key concepts here. The fact that Planet Youth, its underlying principle is a community-based approach, and multi-sectoral partnerships and collaboration. And so can you tell us a little bit about multi-sectoral collaboration and that community-based approach?
Yeah, so the key element is the community. So it's the method is based on that. It's not the responsibility of any one stakeholder in society to solve this problem. I mean, this is a thorny problem. This is a strategic challenge. So you can't expect the schools or the health system or parents to be the ones that solve it. So creating that coalition, creating that community, creating that coalition in the beginning of the project and maintaining it throughout is a key issue. And the coalitions, it's the practitioners, it's the primary prevention practitioners, treatment specialists, it's the politicians, municipal level and national level. It's the schools, the education sector. You know, it's creating that coalition that then takes affair in the community, and the community is the parents. It's the schools where the kids have their day-to-day interactions. So that element is key in the model. And the other, or one of the other elements is the data. You know, collecting data. We have a structured core questionnaire that we use to collect data from the kids. We ask about risk and protective factors. We ask about like time spent with parents, participation in leisure time activities. We ask about substance use, obviously. We ask about different well-being variables and factors. And then we do population surveys. So we try to ask all of the 15-year-olds, for example. So a response rate of 85%, that's what we work with. And then we return the data in form of reports to the partners within 6 to 8 weeks. So the partners, the community, the coalition can actually work with data that is fresh. It's not 2 years old. It's not an academic article. It's in a usable report. And you can use that data to base decisions on. An example, on the other side of the planet, there's a country there, Australia. My wife's Australian, so I can tell stories from Australia. So they actually found out in one of the communities there, the more the kids played rugby, the more they drank. So, which should be the other way around, because sports should be a preventive factor. But then they knew this. This is what's happening now. This is like 6 weeks ago. So this is something we could deal with now. So their initiatives is to train the trainer, is to limit access to alcohol and educate the parents about the harmful effects, giving the local context being permissive towards alcohol use in kids. So just an example of that, we use the data to make decisions, and the data is timely, comprehensive, and has this recency that we can use to make better decisions about the kids.
Thank you very much. I'm sure we'll have more questions for you later. But I'm going to turn to Melanie next. So you're implementing the Planet Youth at a provincial level in both official languages. Donc, pouvez-vous nous parler des partenariats provinciaux et d'innovation dont vous implantez Planète Jeunesse dans les 2 langues officielles?
Absolutely. So thank you for the question. My name is Melanie Cormier. I'm a senior program advisor with Public Health New Brunswick, with the government of New Brunswick. So for us, implementation of Planet Youth really all started back in 2018. So our Chief Medical Officer of Health, Dr. Jennifer Russell, invited Dr. Harvey Meltman to come and present at our Cannabis Symposium in New Brunswick and speak to us about the Icelandic Prevention Model. So following this, she was able to approach Cabinet and present on the approach and on youth substance use prevention. So this really enabled us to explore the model a bit more. It's been identified as one of our 12 key priorities in our Addictions and Mental Health Provincial Health Plan, and as well as our Department of Health Provincial Health Plan since then, so back in 2022. For us, the department, our role is to fund, to plan, and to monitor or evaluate our programs. And we've implemented, so we've started with a 5-year pilot project, trying out the Planet Youth process in 4 pilot sites across the province. From there, we've had coalitions, like Paul mentioned, or local action team developed in each of these 4 pilot sites. So these coalitions are very important to the local work. And they're comprised of 2 co-leads, which have paid protected time to be part of this coalition, as well as various partners, so from youth serving and community serving agencies, parents, youth, municipalities, schools, etc. And as most of you, I'm sure, already know, New Brunswick is a bilingual province, so it was very important to us from the start to ensure that all training, all resources, and everything associated was available in both French and English. So we've worked really closely with Planet Youth since the beginning to ensure that we offer training in both language, that all resources are either being translated or co-created bilingually, and then also in terms of referring to Planet Youth. In French, we refer, I believe, as Dr. Cam mentioned, to Planet Jeunesse Nouveau-Brunswick. So we've worked with Planet Youth to redesign a logo for our province, which absolutely meets all of our partners' need in both official language. So I believe that the collaboration with Planet Youth has been very important to us in terms of having access to resources in both language.
Grace, maybe a quick follow-up question. So you're from health, basically. Have you managed to get other sectors involved in either at the provincial or at the local level?
Yeah, absolutely. So I would say that one of our big successes with Planet Youth has been collaboration. So we've been able to work across government sectors. We do have a provincial project support team in place, which includes representatives from various provincial government sectors. One great example is an agreement we have with our Department of Education and Early Childhood to really enable us to engage local schools and local school districts, as well as support us through survey administration. So it really helped have a really seamless data collection in New Brunswick. And then at a local level, like I mentioned, we have co-leads identified in each of the region. These are either public health practitioners or community developers or other interested parties that are working locally and through their work have paid protected time to support Planet Youth. So that's been a very important partnership for us. And of course, through working locally, they've been able to engage many partners at a local level.
That's great. Congratulations. So I'm going to go to Joanne next. So if you can tell us a little bit about what you've been doing in Calgary, and we're really interested in the Indigenous parallel approach.
Okay, can you hear me? Okay, great. My name is Joanne Pino. I have a Blackfoot name, which is Igaki Maki, which is striving towards something, or that I am trying hard, which I am today. So I'm honored to be here in these lands, and I honor the Indigenous people who are here since time immemorial. And I also honor any elders that might be in the audience here today. I also honor the youth representatives. I'm honored to be in the same room, in the same space as yourselves. And I also want to mention that I have a couple of colleagues from Calgary here. So if you have any general questions about our Planet Youth, Jeff Coldry is here. Jeff, can you give a little wave to people? And then I have an Indigenous colleague from partner agency Muskanawa named Jennifer Fox, who can also answer questions about the Indigenous parallel. The other thing that I want to mention too is that a lot of the information that we have learned about the Indigenous parallel and that we're implementing in Calgary comes from our elders. So I really want to mention Elder Reg and Rose Crowshoe from the Piikani Nation. They are Blackfoot, as well as other elders that we work with. In Calgary, I guess that it feels like we've done so much, and also at the same time, we're still kind of at the beginning steps. I think that one of the interesting things in Calgary is that United Way of Calgary is a philanthropic organization. So we have a lot of experience working with other long-term multi-partner initiatives in the community, which has been really helpful. And it's also helpful that we have professional fundraisers that can help with raising resources for our work with Planet Youth. I think that one of the most important places as to where we started with the Indigenous Parallel was initial consultation with the elders that we work with. And I highly recommend that anybody who wants to start an Indigenous Parallel start there, because elders are like the books and the knowledge in a community. And we're losing that every day because elders are leaving us. So we really want to make sure that that's included. But I think equally as important is that Indigenous youth voice. Super important. And that's one of the things that we did a lot of and continue to do, is engaging Indigenous youth in our meetings. So it's not simply getting a youth advisory as of yet. We actually have what we call youth elders who have came forward through our partner Miskanawa, who have helped us to actually design and actually figure out what the next steps are. So these are older youth that are perhaps in their late teens to early 20s who have really helped us. And I think that one of our jobs as far as the Indigenous Parallel goes is to try to connect the elders and the Indigenous youth together, because they're really missing that connection for a lot of reasons. And one of the reasons that that is so important is because something that we have to realize with the Indigenous communities is that Indigenous communities traditionally are oral, verbal communities. On the other hand, we're working in a Western context where writing is kind of an authority, you could say. It has jurisdiction through our laws, policies, and so on. So what do we do if those two systems don't understand each other, and if they clash? It's difficult then to work together. So we have to figure out, and this is where our elders were so helpful to us, how to culturally translate particular Western concepts, including the 10-step Planet Youth model, into how do we see that from an Indigenous perspective. In Calgary, because of where our reach is and where our connections are, we're starting with the Indigenous urban communities. Not so much the reserve communities yet, although they do come into Calgary, in and out. There's lots of movement there. But we're starting there in Calgary. And so we've built some community action teams, and we plan to, in our 4 pilot communities, have an Indigenous parallel, as well as eventually we'd like to have a physical Indigenous site. And that's kind of an introduction to it, I guess you could say.
Great. Actually, I didn't know how United Way was initially involved or engaged. Could you just tell us a little bit about that?
Yeah, it was a few years ago. We just kind of heard about Planet Youth, and knowing, that there was like a lot of substance abuse going on for the youth, and with the Indigenous youth, there's also like opium crises. So we really wanted to find something that was beyond a standalone funded program. We really believe in collaboration, so we just simply started having discussions with it and started inquiring about that model, and we started to bring people together. Food usually helps when you bring people together, so we had gatherings with food, and we kind of built it from there. And with the Indigenous Parallel, we started off with our elders and started off with that consultation. Eventually, as we start to build out and start to expand the Indigenous model, then we went into getting some youth involved, which I mentioned. We've also got a lot of partners and funded agency partners who serve Indigenous youth and started to come on board. So we've just kind of started to build from there.
Thank you, and thank you so much for really emphasizing the importance of Indigenous culture, knowledge, and wisdom as foundation to your work. and food being part of that culture as well, I think, which is great. And I do have another question that I would love to ask you later, but I'm going to turn to David first, from Lanark County. And you're famous because you're the first Canadian community to implement Planet Youth, and we'd love to hear about your experience.
My microphone is beside you.
This one here?
Yeah.
Okay. It's on this side.
So thank you very much. I want to add my gratitude for the opportunity to be here and to speak to this wonderful group of people. I first heard about Planet Youth and the wonderful work that had happened in Iceland at a community meeting in 2017 in Carleton Place. And that meeting was organized around the opioid crisis. A few hundred people attended that meeting, and everyone was offered an opportunity to be trained in the use of naloxone, and people were able to leave the room with that. And it really struck me, and I think everybody who was at that meeting, that here we are in our community, you know, walking out of a meeting with this kit. During the Q&A of that meeting, a local physician, Dr. Janice Gray, who I'd like to acknowledge is sitting over at this side of the room here, stood up and said, "Has anybody heard about the wonderful things that have happened in Iceland?" So it's her fault that I'm here. A week later, we had an ad hoc meeting, and a year later, we formed what's called the Planet Youth Lanark County Steering Committee, which is a group of volunteers. We decided that this was something that we could make work. We decided it was something that was important to do. And we decided that it made sense to do that at the level of Lanark County. So Lanark County has 9 municipalities in it. And so we felt that was a good grouping. And in fact, about 10 years before that, there had been a move to start a municipal drug strategy network across Lanark County. So this very strongly falls into the prevention pillar. And I would say that at the local level, we were kind of struggling a little bit. What do we do? And what I felt was really important was the evidence that this program is built on, or this process is built on, and the idea that there is a recurring gathering of evidence. So we would have a dashboard that we could see, are we making a difference? Let's do more of the things that are working. Let's not spend our time and scarce resources on things that are not working. So having formed our group, we were able to sign MOUs with both school boards that service Lanark County. They're large school boards, so Lanark County is just a section of their area. They serve multiple counties, but we were kind of ready to go. And in fact, we hosted a visit from Professor Elfgeir Christensen, who came and talked at some community meetings, and in an informal way did an assessment, kind of saying, are you guys ready? And he said, yeah, he thought we were. So we were very excited to announce in January of 2020 that we were the first community in Canada that was going to be doing a Planet Youth survey. And we were going to do that survey right after the March break in 2020. Just perfect timing. So of course, everybody was sent home. Everything was put on hold. It was really tough to see that happen. But we waited 2 years, and our first surveys were done in end of February, beginning of March of 2022. We had, you typically look for 80-85% participation. We had 70% of the grade 10 students attending school in Lanark County respond to the survey. We had 2 snow days, it is Canada, and if you had the sniffles, you couldn't be at school. So we thought 70% was a pretty good participation rate. And so we're now in the process of disseminating, and in fact, on Thursday of this week, we have a community meeting to do some goal setting. So this meeting is perfect timing for that, because we're hoping to get some pictures and put them up on our social media and get some more people out to the meeting on Thursday. I have to say I'm a bit jealous. Isn't a good thing to be, but I'm envious of the support that that our colleagues have here on the committee, or on the panel here. We have very strong support from our health unit, and in fact, Rebecca Shams is over here. And she's been doing a lot of work on youth engagement, and we're very grateful for the support we have from our health unit. We also have Kevin Cloutier, who's at the side of the room here, who's the Executive Director of Open Doors for Atlantic Children and Youth, which is a community-based mental health service provider, and they provide our governance. We report to their board, essentially. So we're very pleased and very honored that they're taking time out of their busy schedules to work with us, but we don't have anybody with that paid protected time. And that's tough as a group of volunteers. Our committee is meeting regularly. We're working hard to make this happen because we know it's important, but that's a difference that we have from other groups. I think there's power in being grassroots, but there's also some challenges there.
Thank you so much, David. So, other than obviously you could do a bit more dedicated support and resources. What would you say was your key success or your key challenge?
Okay, so key success. So one of the things I think that has been really powerful is when we've looked at the evidence, we've looked at the data. And what we saw is that 69% of our grade 10 students are chronically sleep deprived. They're getting less than 7 hours sleep a night. And when we look at the data, we can see associations for grade 10 students in Atlantic County who sleep more than 8 hours a night. If you ask them if they're happy, they're 3 times more likely to say yes than a grade 10 who's sleeping 7 hours or less. If you ask a grade 10 who's sleeping 7 hours or less if they've consumed alcohol, been drunk in the last 30 days, consumed cannabis, they're about twice as likely to say yes to that question if they've slept 7 hours versus 8 hours. They're also, if they're sleeping less than 7 hours, they're much more likely to self-rate their physical and mental health as being, poorer than kids who are sleeping more than 10 hours. So this is a very profound learning for me, and I started asking experts that I had access to, is this a symptom or is this a cause? And what I've learned is that it's a cause. Not sleeping enough results in a much higher probability of being mentally not well, it's a predictor of youth substance use. So this is something this is tangible. We can do something about this, and this is something that we can do. We can approach this across all of the domains that are described in the Planet Youth model. There's clearly something we can do in schools because school start times have something to do with it. In Lanark County, adolescents start school at 8 o'clock in the morning, and elementary school kids start at 9:15 or 9:20. That's flipped from where it should be. There are things that parents can do to improve sleep hygiene in their homes. So I think it's really an important thing here, and it's not going to be controversial. Nobody's going to say they don't want their kids to feel better. Nobody's going to say they don't want their kids to be healthy. So we have something really solid to work with and engage our community on. So I'm really proud about that. I'm happy that we have that data. So the biggest challenge, I would say, is the fact that everybody's doing this off their side of their desk. So I think we would have been 6 months ahead if we had had somebody who was dedicated, who we could have been working hard to form those coalitions in our community, because we're all volunteers.
Thank you so much. And I see a number of public health colleagues in the room, and we always say public health is local. And one of the key roles, I think, of public health is convening and making sure that partners come to the table. And so just acknowledge the public health local experts and practitioners as well. And I think all of us who are grappling with investments in our health system, particularly those in public health, is trying to convey the message that we do need to move more upstream. Not that downstream isn't important. You really do need treatments, but the upstream mustn't be neglected. We need to kind of do both, but it's very difficult to convince decision makers in many places to go, as it were, upstream. And I wish we had a stream. It's a good picture to have in our heads. I wanted to go back to Joanne for a second, and before we open up to the audience, you were saying that trying to translate verbal or an oral tradition to written is something that you've had to do in terms of rethinking planet youth in the context and the population that you're serving. Can you describe a little bit about that? And now we're not just writing. I'm not sure how much writing people actually do. We're now totally digital and social media and everything. So have you had some experience with how you implement on that front?
Yeah, so we first initially really learned about the importance of this and a little bit of how-to from our elders through our United Way's Indigenous strategy called Egakshtaman, which is journey of creating goals together. And when we were first introduced to this idea of paralleling, for example, in a meeting, if you're out in the Indigenous community, we might start off with a smudge, which is a spiritual practice. And so it definitely helps to ground you. That's our understanding of the smudge. It helps us to connect to Creator. And it's also a way to open a meeting. So if everybody was kind of buzzing around and making lots of noise, once you light that smudge, it's a signal for everybody to sit down and be quiet and let the meeting begin. Similarly, if we were in a Western court of law, we might use the gavel to start the meeting. So that's kind of an example of a parallel. So they're not necessarily the same things, but they are things that are similar enough so that you can create a frame of reference to understand and communicate to communicate better between the two systems. So when it comes to Planet Youth, for example, we think about community prevention and upstream prevention. So what is that from an Indigenous perspective? So we work with our elders on this to try and understand what that is. And what we come back to with the elders' advice and community advice and even research on it, it talks about community upstream prevention being more along that connection to culture, which is, I would say, a lifeline. It's not fluff. It's not something that needs to be added on as kind of an extra thing to have. But it's so necessary. It's so foundational, especially for these kids that have lost that community culture and know that it's so important. And if we had that connection to culture and to elders, it would really help the youth to navigate both systems, both the Western systems and the oral Indigenous systems. So I think that is really, really important. And so you can go along through that Planet Youth model and you can parallel things. I do want to add one little caveat, and that is that the Indigenous oral system I find is so wise and so gentle and generous in its applications, practices, knowledge, and so on, that it's not always necessarily the Indigenous paralleling the Western way. So sometimes the Indigenous side will come up with something of our own practices and our own ways. And if the Western ways wanted to follow us, then certainly they can follow our lead as well. So it's not always us adhering to them. It's kind of, we're walking the path together, but there are times when we kind of go on our own a little bit, but then we come back and converge together. So it's like those two canoes going down a river who are traveling to the same destination, but we're doing maybe a little bit of a different methodology at times. I hope that makes sense.
That's great. Thank you so much. That's really, really helpful. I'm actually going to open up the floor to anyone in the audience who may have a question for our panelists. And the mic is traveling over to you. If you could just, anyone who's asking a question, just have a brief introduction of who you are, where you're from.
Hi, thanks everyone. My name is Brian Pottle. I'm outgoing president of the National New Youth Council. So I have two quick questions. One is, sorry, I forget your name on the left here. You mentioned about how you guys have really quick turnaround on data collection, using that data, running with it. I guess, how do you safeguard it with data fidelity in that way to make sure that you're not misreading the data? Like, for example, on the right, you mentioned using data that correlated, at least superficially, 7 or less hours of sleep with increased substance use. So then it's like, how do you draw the right conclusion? Does one substance abuse engender or lead to a lack of sleep, or vice versa? So how do you kind of safeguard to make sure the data is good data and doesn't misinform action? And secondarily, this is more of just like a kind of conversation, I guess. So I've seen, for example, in the indigenous communities, I've lived on a reserve in Saskatchewan. There's a couple of dry reserves in my home region in Labrador as well, First Nations reserves. And I grew up in a community that, while not officially dry, and by dry for those wondering, it means alcohol is not permitted. It's illegal actually for the reserves. So I've seen where as a kind of band-aid solution to mitigate against the social issues created with alcoholism, that banning alcohol was the solution. But then it led to other unintended consequences, like youth sniffing gas, because that's more accessible now than alcohol, which is just crazy and so dangerous. So I was wondering, for those on the panel, do you have any thoughts as to how such a band-aid solution, why it doesn't give the desired effect of curtailing substance use in general, and why in this case it just instead of being successful in getting youth and kids to stop basically getting drunk and whatnot, it just shifted from one vice to another. So just to summarize, the data fidelity aspect with the quick moving piece you mentioned, and why aren't dry reserves and whatnot as successful as they want to be? Thank you.
Great, thank you for those questions. I'll turn to Pal first.
Sure. Regarding the data fidelity, so we try to survey all the students. So these are population surveys, which means that we don't have any sample population statistics to go into. So we don't have to talk about significance and the risk of the sample not being like the population. So that's one element that secures data fidelity. The other thing, we got the questionnaire that we use, and when we get the data back, we have a lot of methods and algorithms that go through the data and filter out and clean the data because kids, they can do 1, 1, 1, 1, 1, 1, 1, and when I was 14, I did 3 kilos of heroin in one day, and all of these things that you have to filter out. So we got that. So you filter that out of the data set. So what the partner gets is like a clean data set, just with those numbers. But then about the interpretation, we don't really interpret. The reports are pretty standardized, and they're not for publication. They're for use. So we have correlations. We have the descriptive statistics. We have all of those data is in there for the partner to interpret, because the partners they know their backyard much better than we do. We assist, and when the methodology is based on, we have a defined workshop structure, and we teach how to read the data and how to disseminate. But the interpretation and the causality, and I'll let David talk about the co-causality question later, but that's that's the partner that interprets. We support, but it's the partner that interprets and then ultimately decides what should we be doing, like the Australian example as I had before. So what should we be implementing to ensure that this problem goes away? Not for the kids that were surveyed, because the next time we survey, we don't survey the same kids. We survey the kids that have been subjected to the intervention. So we're actually we're not trying to figure out how the kids are doing. That we get that information, but we are testing. We are measuring the impact of interventions, and as we go along, we have this is 5-year projects that we initiate, and obviously after 5 years you continue. But over time you build up this database of information about how the initiatives and the intervention strategies are working.
Thank you. David, did you want to?
Yeah, so on this particular thing about sleep, as I said, I saw the data, and that caused me to ask some questions. And I'm fortunate that one of my other volunteer roles is I'm on the board of the Royal Ottawa, and there are sleep experts there. So I consulted, starting with Dr. Gail Beck, who's a child psychiatrist and the interim chief of staff, and asked her, what am I seeing here? Is this real? And she said, absolutely, David, it is, which started me on a journey of learning a lot more about the importance of sleep. And I can tell you one benefit of that is that I'm sleeping better myself, because I'm starting to practice better habits, which I hadn't been. I actually put my phone away at night. I'm trying to anyway. So I think you really need to ask those questions and do that corroboration, and that's part of what I've done there. And so I'm feeling confident that we've got a really valid result from which to stimulate action in our community. I'd also like to comment on alcohol. What we see in the reports that we have is that there are expectations that time spent with parents on weekends is going to be a protective factor. And we see those kinds of expected relationships with consumption of cannabis for sure. For sure we do in our data. Not so much with alcohol. I think in our community, dealing with alcohol is going to take a different kind of strategy, because alcohol consumption is very normalized in our community. I think it's very normalized in Canada, and I've seen similar data in the Planet Youth reports that are published on the web, by the way. If you want to see our reports, go to our website and you can see them. But the results in Ireland and Australia seem to have the same sorts of behavior, where the things you would expect to be protective factors don't seem to have as strong an influence on alcohol. I think it's a challenge that we have to face.
Thank you. We have a number of questions on this side of the room. The mic is traveling over to you. Maybe the gentleman next to the window first.
Thank you very much. Magron Bujako, Ambassador of North Macedonia to Canada. I'm very privileged to be in such a company, to the Honorable Governor General and the President of Iceland. My question is directly to Mr. Rickardson, because I saw the countries that you are present in the catalog that you gave. Well, I'm interested if you are planning to come to the other regions with different cultural experience, because they are mainly Western or Western culture countries. Will be very interesting in Macedonia or North Macedonia or in the Balkans to be present. And my question is concretely, because I was in the government, I am a diplomat now, I will do my best to propagate your action, which is excellent. Congratulations. My question is directly, after you collect data, and this is a process, how you manage to engage communities or partners or coalition? Because we are very different. In the Balkans, we are a mixture of cultures and religions. In your experience, do the religious community help? And the second is the social media. Are the social media in which way present in your actions? Thank you.
Thanks for that. So we are in Slovenia and Romania, so we have a little bit of experience from your neck of the woods. I would say about engagement, I got 4 kids. They're 12, 14, 27, and 25. And I started again for some reason. So the gap between how you engage, how I was involved in schoolwork for the 27 and 25-year-old when they were kids, and how I'm engaged and how I receive information and dissemination from the schools from the 12 and 14-year-old are quite different. They're worlds apart. So our disseminations and engagement, they usually start with the coalition disseminating in the school environment where the kids are. So the reports are on a school level, and then they're on a community level. And today, well, back in when I was trying to engage with my big girls, that was, my body had to go down to the school and listen to the reports being presented. But not so much today. So social media, absolutely, is a very important factor to use when you're disseminating data. And also and for us, you were talking about other communities and cultures, like we don't tell how to do this, we assist and support, but there are different communication traditions, ways of disseminating in different coalitions. Like we are in South Africa, and in South Africa, communication through web pages, doesn't work because parents, they don't really own computers. But so it's through mobile telephones. All communication is through mobile telephones and through community meetings in the community centers. So in dissemination strategies, with the data that is being collected, dissemination strategies, we adapt that with the partner to the local context, and it's a wide variety of difference in between those communities.
Thank you. I might just go back to a previous question which wasn't answered about dry communities, I think it was. But maybe I'll just turn that question around a little bit and ask Joanne. So you started in the urban setting. Can you tell us a little bit about engaging communities that may be on First Nations reserves, for example?
So we haven't gotten there yet. But what I would say that if we were to move out working with surrounding communities in and around Calgary, Mokinstis, I think that one of the things that we would need to do really is a key principle that we learned about in Agakshtaman. We call it making relatives. So you might have heard of All My Relations, which is about the interconnectedness of everybody and everything. Making relatives is similar to partnerships, except it's a deeper, very authentic kind of relationship building where we bring our hearts, our minds to each other to make action. And making relatives is a journey. It's not something that's done overnight. It's to create trustful, respectful relationships. And as Indigenous people, we are very relational. Relationships mean everything to us. And if there isn't relationship in science, in data collection, or in reporting back, it's not science to us. So it's very different. And the other thing I think, if we were to move out to other communities, is that we would need to be invited. We can't impose ourselves, obviously, because we're going to be seen as strangers if we haven't made relatives, and it won't be safe. Indigenous people will not feel safe to engage with us if we ignore that. And I think that the other thing that we would want to do, if that were to happen, is that we would want to really build relationships, make relatives with the community's elders and with the community's Indigenous youth to help that process along. And your question about the dry communities makes me think, for one thing, I would hate to assume why that is, so you'd probably have to go back and ask the community about that. If I were to just take a guess about why that is, I'm thinking it might be because if you look at our history and our current position in Canadian society, we've been subjected to a lot through many decades around colonization. So a phenomenon that has occurred is called intergenerational trauma. And so that's generational due to a lot of things that we have suffered, and we continue to deal with that. So I see things like alcoholism, taking drugs, addictions, low education rates, all of these kind of things. I see those as symptoms, and I see what is the real underlying need to happen is healing from intergenerational trauma. And so if we see intergenerational trauma as a root cause, then we know that we have to do healing as a people and as a community. as well as that connection to culture, which is healing as well. So there's a lot of work that we have to do, but it has to be Indigenous-led, I believe, rather than us coming in to offer solutions. If we're invited, then that's great. We can work together.
Thank you so much. And
May I make a quick comment too? I think that I'm not an expert at all in many of these things, but it seems to me the dry approach is a variant of the just say no kind of thing. Like it's telling people not to do something. And there's a really wonderful Planet Youth project in a place called Franklin County in Kentucky, and their project is called Just Say Yes. And I think it's a beautiful, beautiful way of looking at things.
thank you. Unfortunately, we're kind of running out of time, and I wanted to maybe, seeing as we haven't asked Melanie a lot of questions, I just wondered, as you're designing your data and data collection, have you taken into account social media, and does your survey or your data collection take that into account? Because we had a number of questions about the impact of social media on mental health and on substance use.
Yeah, absolutely. We've just received our data a few weeks ago, so still very new. We wanted to make sure that our communities were the first to see the data and really took ownership of their data. It doesn't belong to us at the Department of Health, but rather to the communities implementing Planet Youth. So they've been doing some training with Planet Youth and really looking at the best way within each of these four sites, which are very different. So social media has absolutely been brought up, community meetings. We also just last week launched our webpage in New Brunswick as well. So potentially an opportunity to share some of the findings there.
So we look forward to that, and very much. So I am going to, unfortunately, have to go to the next part of the agenda, but I think as people mingle after the closing of the session, you're going to hopefully be able to swap names and emails and contact information. So, I just want to thank all our panelists. Let's give them a round of applause. So next I'm going to ask the Honourable Carolyn Bennett for some closing remarks. And Minister Bennett, if you do that. And then I'm going to ask, after Minister Bennett, Jon Stigfersen, the chairman of the board of Planet Youth Iceland, to have the last words.
Thank you, Teresa, and welcome, and thank you to the President, the First Lady, and I fondly remember the trip to your residence and the amazing conversations. But today I think that you really, we all are asking who is in control of our destinies, and that reminding us that we should be in charge of our own life. But I think the piece around self-worth, and I think that it speaks to really what we have learned from the Indigenous communities here, that and particularly from Her Excellency, in terms of how important the secure personal cultural identity is, how knowing who you are and being proud of who you are, whatever nation, Inuit, Métis, nationality, to be proud of that helps people make healthy choices. And I think that is really why we're here today. And I think with Her Excellency and her teaching us all, not only her commitment and that of His Excellency to mental health, but also to resilience. And I think the Governor General's been amazing to teach us all some of the words that we don't have in English, that are there in Inuktitut, and as you come here to worry about really the protection of language, and how so often there are things that you can't say other than in your maternal language, but that there are, I think it was Ajuinata, the Governor General's word about in one of her year end about commitment and promise and vow, but also to the fact that there are creative and innovative solutions that we can steal from one another. And I think that's really what's here. And I think that for us to not only acknowledge that we're here, as Teresa did the beautiful land acknowledgement on the unceded Algonquin territory, that we are all learning in our country from the First Nations and the Indigenous Inuit and Métis people. I almost every day have my medicine wheel on. It reminds me that pretty well what I learned in medical school was not very helpful in keeping people well, not just patching them up when they get sick. And that the idea of trying to find that balance mentally, physically, emotionally, spiritually is actually what a life cycle approach should be, and how it is about finding that secure personal cultural identity that is about that people will expect of you. And I think that's why really being in touch with the elders, we always say, and that how come in the Indigenous communities they're elders, but in our community they're elderly, and that we actually have to learn about all of these. And I think the president must be so proud of, for a small country, to hear now really about 5 continents that this movement is reaching, and we are very proud of the 3 projects that you've heard here in Canada, and it is that and I know my colleagues from Parliament, Dr. Handley from Yukon, as well as MP Kellaway from Cape Breton, that there is a movement happening here in Canada as people reach out to us in the Public Health Agency, and to be able to understand that it is bottom up. I mean, I think that's what we're hearing, is that this has to start bottom up. It is evidence-based, but it has to be community-led, and it is based in that kind of research that we've all heard, and how Dr. Paul was saying that again, it has to be fresh data. It has to be where you measure, adapt, and we keep tweaking things. That it has to continue to be iterative, and we have to be honest in that. I think we've also heard this afternoon there are no assumptions. That sport will be good for you, or going home to your alcoholic parents on the weekend may not be a good idea, or that you will actually be able to be able to see, for young people to be able to see things with fresh eyes based on data, and not necessarily sucked down into the vortex of some social media norms, where if they can actually find peers that actually are looking at the same data and saying, you know, we really should get more sleep. And we're finding with a movement in Canada called Brainable that when they actually find out how important sleep is, that they can actually decide they'll change. It took me 25 years of delivering babies and being sleep deprived for 25 years the Prime Minister believes in split sleep, and I'm finding that it really does help, actually. And I wish I'd figured that out a while ago, but I really think that we did understand how building those partnerships are, but I think Melanie was pretty honest that unless people have paid protected time, that it's hard for people to take time for the meeting to build those partnerships. And I think that was hugely important, because, and the fact that from early childhood educators it's never too early and it's never too late. And I think Joanne was amazing in talking about how you have to actually build it with the elders' real wisdom, but also listening to the youth, who will tell you what won't work and what will work. And I think that has been, again, David's point about how having a evidence-based dashboard, but also being honest about what's working and what's not working and being able to move on. And so I think that it's been really a spectacular afternoon. I think that certainly it was when Yukon declared its crisis and then in February 2022, where we first heard from Planet Youth at that 2-day summit, that we realized really how important it is to reach out to try things, but then to realize that so many other people have been trying this and finding that if they can tweak it for their own culture, that it will work. We in Canada have been very inspired by the integrated youth services and the fact that they are working because they're youth led. But again, it's not upstream. It is when people are noticing they're struggling and that they have to seek help. So we need that too. But we also have to move upstream, I think, is what we're hearing today. And I think that we know that COVID was awful, and it was particularly awful for youth. But it was awful for all of us. And I think what we're finding is that maybe people are a little bit more likely to talk about their mental health. Are people a little bit more likely to talk about that they're worrying about their substance use? And if people are prepared to say that out loud, then the stigma comes down and we end up with less barriers to ask for help. And I think that we've heard that. But we are also seeing that there are certain communities within Canada where the stigma is still really high. And it's going to be the youth that actually say, no, to their parents and to their grandparents. We've got to talk about mental health. We have to talk about substance use. That it's going to be the youth that will break through that sort of the stigma that was cultural or was just that we didn't do that in our family. We didn't talk about that. And so for it to be that ability now to take people talking about things, being honest in questionnaires, being able to say really and feel it's safe to tell the truth in a questionnaire, that because you know it's going to help make the program better. And I think that is as we think of that kind of research policy practice, we need the research that takes the knowledge translation to the policy, that takes the political will to the practice, and then back to better research questions with the applied research. And that's what it seems that's what Planet Youth is doing. You're giving that applied research that takes it back to better questions and that. But once people understand it, then that circle moves much more quickly. So I just want to say, I think on behalf of all of us, how grateful we are, how we know, Teresa and Heather and I were at the WHO last week, that knowing that people feel the age at first use of so many of these substances is so important, and that this is what you're doing. So I'm just hugely grateful that this is the kind of partnerships we need to be able to facilitate. This is la discussion animée aujourd'hui nous a aidé à revoir ce que nous devons faire pour véritablement favoriser le bien-être mental des jeunes et faciliter la prévention en amont en tant que modèle de travail dans les communautés de tout le pays. I hope that as all of you reflect on today's event, that you will feel energized and hopeful for the future. I think that that's what we want. We want people now to be going to your website, be able to ask the questions, to build the relationships at the reception afterwards, to be able to know what we can all do in our countries, to be able to really move on this hugely successful experiment that took place in that small country that's now affecting the whole world. So, Taka, merci, miigwech, merci beaucoup.
Your Excellencies, Minister, and distinguished guests. It's an honor to be here with you today, and I would like to thank you all for your valuable input and enthusiasm towards preventing our children from harm and ensuring their well-being. That is our greatest challenge and most important task in life. Can we agree on that? We are familiar with the determinants of health, and we know the threats facing our youth. Mental health issues such as depression, anxiety, stress that have become increasingly prevalent among young people, lack of sleep, online safety, online harassment, violence and crime, bullying, discrimination, substance use, and more and more. Substance use among youth is growing all over the world, in most of the world's countries. We're still, Mr. President, fighting on these 2%, right? Yeah. But there are no borders. And everywhere we go, parents, they care for their children's future. So do presidents, ministers, governors, teachers, trainers, practitioners in the field, and basically all of you here in the room. At the same time, there is always more and more demand for rehabilitation and treatment for young people. Still, we already know many ways how to prevent this from happening. We know what we should be doing. We know which environmental factors prevent children from substance use. And we also know which environmental factors cause risk. So let's use that knowledge, because if we don't, our children may come to us in 10, 15, 20 years and ask, why didn't you do everything you could while you knew what had to be done? But after this meeting here, after this day, I am more optimistic than ever that we will not have to answer that terrible question. Because you, the people here in the room, you are a part of that solution. You are the drivers of change. You are the caterpillars of change. And by using community-based evidence, by linking research, policy, and practice, gives us hope that we can return this little earth of ours to the next generation in a better condition than it is right now. And let's prove to them that we can. Can we agree? So thank you very much.
Thank you so much. That's it.
Okay.